everybody. Welcome back. I'm Susan Lindner, your host of the Innovation Storytellers Show, where we help innovators like you really begin to understand the story behind the innovation and help you tell a better story so that you get the resources, the runway, and the recognition you so rightly deserve for your breakthrough ideas and all the changes you're trying to make happen as a real catalyst inside of your organization. And it's why I'm so grateful today to have my guest, Robin Goldsmith, on the show. Robin is a health innovation principal for Verizon's healthcare, insurance, and life sciences division. He brings more than 20 years of experience building trusted partnerships that drive successful business outcomes for his healthcare clients. Prior roles within companies focused on patient engagement and education, health data analytics, and digital transformation give him a holistic understanding of the provider market like nobody else's. And at Verizon, Robin is responsible for building innovative solutions on top of Verizon's core infrastructure to really accelerate digital transformation for Verizon's enterprise customers. He is passionate about improving healthcare for patients and clinicians through smarter technologies and smarter connectivity, head and heart, I hope, wherever care is being delivered. So, Robin, thank you so much for joining me on the show today.
No, thanks, Susan. It's great to be here. And I love your mission. So I'm happy to be here.
We are on a mission to combine great innovation with great stories so that the rest of the world adopts those incredible innovations. That is the work. That is yeoman's work. And that's what we're doing here. So tell us how you got into this crazy, wacky world of innovation to begin with, Robin. Nobody walks in the front door of innovation.
Oh, it's kind of by happenstance. I'll be honest. I mean, like you said in that very kind introduction, I'm very passionate about healthcare. I've been working on this in a variety of capacities across a few companies now, from patient experience, patient acquisition, data analytics, et cetera. And I just was lucky during the pandemic when we're all doing this, utilizing screens to do our job. I had the opportunity through an old friend of mine who was at Verizon, and the company that I'd been working for made some transitions, and it was just happenstance. He had an opening, and I jumped on it, and I had that kind of light bulb moment of being in the pandemic in my Brooklyn apartment, and that connectivity and the devices that are needed, and we were seeing it happen in real time, that the telecommunications companies of the world really have they have a really large role in this and where healthcare was kind of going. And so I'm very excited. And I always say I have one of the coolest jobs at Verizon. So that's kind of how I got there. It was through the network. And again, a lesson that always try to keep relationships and stoke those relationships as best you can, because you never know when an opening will happen. So
it's so true. We don't often talk about the relationships from a storytelling perspective, but it really is the heart of getting other people on board with your big idea. It's got to start with that, right?
Absolutely. I think relationships, I've always been relationship focused, and within a big enterprise organization like a Verizon, I think it's even more important to find your allies and kind of stakeholders that will help you tell that story and bring a coalition of the willing together to make things happen. So I think it's critical. It's probably even more critical internally at a large organization than externally.
Yeah, especially when you have to work across so many silos just to get your big idea, the awareness of your big idea, number one, and then number two, to actually get people to put their reputation on the line to say yes to helping you with it.
Absolutely, especially as we're talking to the market about technologies that are, I wouldn't say new, but they haven't been around a lot of years. So in healthcare, it can be challenging to get those first key adopters and early adopters that then the rest of the market will look to and say, those guys are already at the party, maybe I should give it a shot. So it's critical.
So let's talk about some of the innovations that you've been working on and some of the stories that go along with it. So you're very focused on helping providers use Verizon's technology infrastructure to really make life better. How do you do that?
So I think adding on to kind of what you said, my remit is to look at the Verizon capabilities, the big Verizon garage, as we like to call it, of all the things we can do, which is It's really vast. I had no idea before joining Verizon really what we do. And from a business perspective is where I sit. Most people know Verizon because of the phones and the stores and the advertising. And that's really the depth and breadth of their understanding. But it goes far deeper than that. We work with a high percentage of the Fortune 500 companies. And when it came to healthcare, I think my team's job is to tell a better story of what we can enable in healthcare, because I think versus any other industry, finance, retail, manufacturing, healthcare is the most challenging. And we're all really passionate. My team all comes from healthcare in one way, shape, or form. And we're really passionate about taking what Verizon can do and bringing it to our healthcare customers and telling that story of really what this can enable. And I think it's a really exciting time to be in healthcare. I have to bring up COVID, unfortunately, but if there was a silver lining, that accelerated a lot of the thinking in healthcare to do things a bit differently. And it was very much needed. And it's shown a light on things that had been happening for a long time, like social determinants of health, people that don't have access to healthcare, rural that have to drive long distances for healthcare. So when we're talking about Verizon and our capabilities, I think just understanding healthcare, it's a very highly regulated, complex industry, making it real for our customer base and really taking what we can do and putting it into their language and showing what we can do for them and what we can enable for them is really exciting. I mean, of any industry, they're going through a seismic shift in how they're delivering healthcare, thinking about the delivery of healthcare. No longer is it just you go to see your doctor once a year. You got the rise of care in the home, and every healthcare provider, every pharmaceutical company, med device, they want to have more touch points to hopefully intersect earlier so people don't get super sick. Anything from continuous glucose monitors for diabetics. I mean, these things are life-saving technology, and all of that, these technologies, these monitoring systems that you see, everything has to be on a network, which is where we come in. And it has to be on a very secure network. Unfortunately, security is another piece of the puzzle where we have a very deep practice that addresses that.
I am wearing my continuous glucose monitor right now. I just got it this week. And you're right. I mean, it's amazing to me I'm not pre-diabetic, but I'm on a wellness journey, and I really want to see where my sugar is and what I'm eating and what happens when I sleep and things I never would have known about my body, right? That are just taking place as a result. And the reliability of that data, the security of that data is no small shakes.
And where does that data go? I mean,
where does it go? I have no idea. I know it goes to my doctor and me. Who's got it in the middle? I have no idea. I hope no one. But it's in different pharmaceutical companies who are tracking it, and device companies and lots of others.
Exactly. I mean, but just the fact that you showed a connected device goes to show you that healthcare, it affects all of us. We're all living with our own condition, like myself and you. And even if you don't have a chronic condition, your aging parent does, or your child does, or someone in your family does. So, I mean, it's and then COVID, I mean, healthcare was at the center of this crisis, unlike anything we've ever seen. So I think just this shift to more always on quantified self, if you will, of if you're a diabetic or pre-diabetic, just go into the office of your doctor. As much as that's great, it's a snapshot in time of where you are there. 2 weeks later, things could change radically, and you're not going to know unless you have a CGM on your arm or some other kind of device that's telling you what you should and shouldn't be doing. So yeah, it all makes sense when you kind of boil it down of where these big connected companies like Verizon that are enabling all this innovation to happen they're really critical.
So what's the conversation like when you're trying to get other folks on board? What is that like when people are like, I don't know if I want to take a risk on this, or talking to providers and really getting them to see the light?
Yeah, I think thankfully, I'm with a very trusted brand, which definitely helps the conversation. Sure. If I was with Robin Goldsmith Wireless, I'd probably have a much harder time.
I mean, I'm trusting it, Robin. I don't know about anybody else. I'm okay.
You shouldn't. But, Verizon we're a trusted brand, and that our brand is something we protect and hold at the core of everything we do as a trusted partner. So we have that benefit, but I think at the core of it is telling a story, a better story of that resonates, like a lot of your guests probably tell you, that you can talk about the speeds and feeds of anything. And especially with technology, having a technology for technology's sake is never going to win when you have a customer base in the health systems that are, for the most part, I'm not generalizing here, but their margins are thin. They're struggling with a lot of different challenges. They've got staff shortages, et cetera. So I think you have to make it be in their shoes of why they should adopt a new technology and really why this will be impactful. And at the core of it is, how is it going to make my patients' experience better, my staff, my doctors, my nurses' day-to-day experience better? How is it going to make my brand? How do we secure our brand better? I think if you start weaving in use cases that we see across other industries and across other customers that are super relevant, that's when they start to be open-minded to what we can do. And I have to say that the best conversations are people that are thinking about the future of what healthcare is. Got a lot of really cool tech now, but the ones that are thinking about the future and where we want to be in 5, 10, 15 years are really the best conversations, because a lot of the technologies like 5G and private 5G solutions that we're really focused on, and AI and what we can do from a network perspective to bring that data in more real time, is we like to talk to the folks that want to future-proof, to use a very overused term. They want to future-proof their facilities and their new hospitals, for example, for what's coming down the line. And there's a lot of really interesting tech that will make a big impact for everyone that's going through the healthcare system.
It's just interesting to think about, because I think healthcare is one of those places where we don't come in contact with innovation until we're in a tough spot. Right.
Yep.
We typically, and for physicians, they're bombarded by so many different kinds of technologies and trying to figure out, and they're not technologists, right? They know they want efficiencies, but I remember my doctor, he was an old guy, and he sold his practice when EMRs, electronic medical records, became mandatory. And he's like, I went to med school not to cure people, not to learn how to type. And he wound up his practice to Columbia doctors because he just didn't want to do it. He was like, I am opting out of this tech revolution. And so,
yeah, they call it the death by 1,000 keystrokes.
Oh, wow. Death by 1,000 keystrokes. Yeah, I get it.
Or poaching that from a doctor that I spoke to recently. But yeah, they didn't go to med school to be glorified data clerks.
Right. And it's funny, on the other side of that equation, my mom is 96. She's like, I don't have a relationship with my doctor anymore. I have a relationship that goes me and my pain, screen, doctor.
Screen. Yeah.
And oftentimes that screen is literally cutting off the visual between the doctor and the patient. Thinking about even how we make this so it becomes, and I'm hoping that Dragon Speak will make its way into that, the speaking technologies that will be harvested in the word bubbles that come out of us will eventually go directly into the chart.
It's happening. It's happening in real time. And so awesome. The good news is that, yeah, the doctors don't like to be behind screens. They don't like to be tapped. Who would? They all want to be delivering care and looking at you face to face and really having that human interaction. I think ambient listening, the ability to put a phone or some kind of technology.
Is that what we're calling it? Ambient listening, otherwise known as eavesdropping? Alexa and Siri, right?
Yeah. I mean, it's opt-in ambient listening that is taking that conversation so the doctor doesn't have to input it, and it's basically taking that. And there's a lot of companies that have popped up to do this. And I think AI, you can't have a healthcare conversation without AI. And I think that's across industry, but there's such a need in healthcare, because I don't know if you've tried to look for a physician or changed physicians or look for a specialist, but it can be daunting. And we have a major shortage that I don't think many folks really understand. And it's not getting any better. And we can't train doctors and nurses fast enough to fill the need that's happening in the near-term future. Not to be daunting, but part of why I'm excited to be at a company like Verizon, and that we have the ability to and privilege to speak to both doctors and nurses, but also the technology companies that are building solutions to address this. I think it has to happen because we can't continue on this unsustainable path. Doctors and nurses are burning out and they're leaving the profession. We have to make that time between a patient and their doctor better for both parties. So your 96-year-old mom doesn't want to see a screen, and that doctor doesn't want to be on the other side of it. So I think these scribing technologies, another word for it, Susan, I think are critical.
I
and
love
that's
that ambient listening, though. Like, I'd never heard that phrase before, but it's spot on. It's like, and why am I getting served all these ads for new orthotics just because I went to the orthopedist today?
yeah.
Facebook is going faster than our doctor's offices. This is what we know, right? And pretty standard.
Yeah. I mean, it's the priorities of other sectors, I think, are different. Healthcare is focused on delivering care and keeping you healthy and dealing with you when you're at a crisis moment. And I think to a person, they're all thinking about it differently. And I think, again, that door to innovation has been kicked open and innovation is accelerated. So we're on a great trajectory. And I'm always a glass half full kind of person. And I think out of necessity, these things have to happen and they're happening. So I think that experience your mom has when she goes to the doctor will change radically in the short term.
Yeah. I mean, it's pretty radical, right? What we've seen over the course of my mom's lifetime, right? In the 96 years she's been on the planet, coming from a town of 200 people in rural Germany, right? What she has experienced, my dad would always joke that the census always included the ducks that were in the pond as well. It wasn't just the people. And I was like, yeah, and your physician was probably treating both of them too. But we're in a time now where we're just seeing such rapid change. And on the consumer side too, the demand, probably prompted by COVID, but also just our interaction with enterprise technologies, has demanded that, of course, I want access to my chart. Of course, I want to see the films, just like you got to see them, Doc. And I want to see the pathology. And I want my billing all in one place. And I want the ability to send my docs to other people for second opinions and so forth. So our interaction in the office has wound up triggering a desire for productivity tools and efficiency tools as patients, because we have to spend half of our life arguing with the doctor and the insurance company. We don't want to spend half of our time having to bother a nurse to get our charts. We can do that now.
Yeah. Couldn't agree more. And I think a couple of factors kind of go into what you're describing. You've got a lot of digital first natives, if you will, entering into the healthcare system that are used to far more frictionless experiences from every other industry. I mean, I can deposit a check on my phone. I can access all my financial records on my mobile device. It's challenging in healthcare. It's other industries and the expectation. I always think that in some way, healthcare got a pass for a long time. You were kind of given the healthcare that you got. And now that you've got younger generations that have higher expectations, that Amazon experience, to use an overused term, but that is affecting how they're interacting with healthcare and their expectations. They want more. And I think the industry has seen that, and they're doing their best to raise the bar on the experience when you're in a hospital or a doctor's office and the technologies and interactions you have. Prime areas, you think about a hospital room. I don't know if you've been in a hospital room recently, but probably hasn't changed much in the form factor for a lot of years in most cases. But now they're taking that environment and they're considering the technologies that we have in our homes, like Alexa and other smart TVs that a doctor can show you, bring up your chart, some of your visuals, your x-rays, MRIs, et cetera, and say, hey, Susan, this is what we're going to do tomorrow in our procedure, walk you through it, bring in an expert, all on that big smart television in front of you. But then you can access Netflix and access your bill and do all these cool things on one screen, maybe with a tablet. And they've also considered how much light is in the room. Considerations are happening, and we're going to see more and more of that in those kind of environments.
Yeah. So what else do you think on the horizon that we will see in the future as patients that could kind of blow our minds? Like the idea that my doctor can just speak the contents of the chart and it winds up finding its magical home in a form somewhere is amazing. What else are you anticipating that like Verizon's infrastructure can empower doctors and practices to do?
Well, I mean, since you brought up your mom, and I'm really passionate about kind of this idea of aging gracefully in place and how do we really create better environments. There's a lot of really cool things happening. Again, AI, but I don't know if you saw the movie Her, but this
Sure.
idea of a digital companion, right? I think that is going to happen more and more, hopefully in not a creepy way, but
Getting ads for a digital boyfriend at this point. Like a digital companion for my mom would be great. I'm not succumbing to the digital boyfriend. That's not happening.
it sounds like your mom is doing really well, but I'm you're sensing that there might be a change in her gait, which could be a biomarker of something else, detect heart rate, but also be proactive and say, hey, I know you have an 3:00. Here's the subway schedule, or here's the time to get to that appointment. Have you taken your medication? Maybe you call your daughter, understanding.
Yeah, mom, call your daughter. It doesn't always have to be one way. I love you, even if I'm not calling you. Call me. Phone goes two ways. Sorry. Public service announcement to my mom.
Yeah, calls. So I'm excited about that because I think what we as a society are all folks need more dignity, more interaction points, and I think the technology will play a role there. They'll never replace you go visiting your mom, but maybe they can enable just other things that can interact with her. There's so much I think that I'm excited about. That's one piece of it. I think wearables is another piece that's pretty fascinating. Again, going back to how can we take away that one visit a year to your doctor and really use technology to have a more 360 view of you as a patient and a human in this always on, trying to keep you healthy and detecting alerts of when you're not, and really giving you a better understanding of how you're living your life from a health perspective and what you should be looking out for. I think that's all happening in real time. And we're only going to see an acceleration in that.
I love this. I'm thinking like my mom's pacemaker is monitored remotely and she still has to go see her pacemaker guy once a year. And she rails endlessly about having to pay a $50 copay to do what the machine under her nightstand is already doing on her behalf. But in all fairness, you do have a piece of hardware in your body. You might want the mechanic to check it occasionally, right? Is what I tell her.
Yeah. I mean, yeah, I've heard this multiple times that we take our car in to get diagnosed pretty frequently. God forbid there's something wrong with your car, you take it in right away. But with our own body, we're more prone to just delay it, et cetera. So I think that's got to change.
That's a good analogy. It's a really good analogy to think of. I have these different things that light up on my dash when I have to check oil, when there's check engine lights on. And our bodies could theoretically use those same dashboard, our own health dashboard at home, say, you know what, your sugar's not right, like mine, right? I'm a sugar addict. I've come to learn my sugar drops too low. I'm like, wow, I have an opportunity for more sugar. Yes. Now, I should have leafy greens, I'm sure, to supplement that. But if a cream puff works, why not? So, but I'm thinking like there are things that we can learn from the mechanical world that actually help us as humans to really derive more benefit long term. And I'm really eager, especially with the privacy protections in place, certainly, that I hope as a result of that the investments in that will also hopefully lead to lower costs over time. But I know big tech investments upfront wind up creating more costs too. So is there a balance in that scenario?
Yeah, I think, yeah, there definitely is. I think, again, like I said earlier, doing technology for technology's sake, unless it's really meeting a specific multiple use cases to get to an ROI, I think we're getting there very quickly on to invest now of what this will enable for 5, 10, 15 years out is really, I think, a good investment over the long term because it's technology is changing quickly and we're putting more demands on legacy kind of infrastructure. Wi-Fi is great and it's not going away anytime soon, but for enterprise environments that Wi-Fi was not built to be able to deliver these AI that's going through millions of data points in nanoseconds. That's not what Wi-Fi was initially built to deliver. It was built for Yeah, so you could use your phone in a lobby and have good reception and other things like that, and maybe sending an email and things like that. It wasn't built to be able to handle these huge volumes of data that healthcare kicks off the most data of any industry. Go figure. I mean, think about the imagery that you, when you go to the doctor, that's generated all those scans. It's just very vast and dense. And we absolutely need better types of networks to handle that. And then you add on AI and potentially cameras that are using computer vision, all these cool buzzwords. It just adds to the level of this heavy load of data that is only really useful if it moves pretty quickly and enables a doctor to say, oh yeah, I see that AI has gone through 1 million people that look like Robin, and Robin has GI issues. And we looked at people across the country, across the world, all look like him. These are some guidelines to be able to look at. I think that's where we're getting to. And then the pharma companies looking at drug discovery and in a non-biased way. I think it's really exciting. And I think of any industry, AI and this need for real-time communications is really exciting. So,
well, I wanted to ask you if you are going to the HLTH, I guess we're calling it the health conference in Las Vegas in October.
We definitely will be there. Yeah, we love health. It's kind of a place where you get to see these innovations that all the big companies are coming out with. It's attended by the hospitals, the pharma companies, the med device makers, and it's just a place to gather and see how people are thinking about different burning topics. So we're going to have a booth there. Forget the booth number. You can find us there. I'll be there. My team's going to be there. And we really utilize this conference as a way to showcase what we can enable with our connectivity and our networks. So we got some great demos in our booth that we'd love for you to stop by and check out.
Well, fantastic. I wish I was going to be in Vegas, but sadly, I will be in Bali.
That is, I don't feel bad for you. Vegas,
Good.
Bali.
There's only so much Cirque du Soleil one girl can see.
That's right. Wear your helmet if you go on a scooter.
Note to self.
Other PS announcement.
Okay, so I'm going to conclude this conversation with the 3 questions I ask everyone who comes on the show.
Okay.
And that is, number 1, what is the greatest innovation of all time?
Ooh, greatest innovation of all time. I'd have to say electricity.
Yeah, that's a good one. Couldn't have much of anything we're talking about without it. So it doesn't run on fire, sadly.
Yeah. I was going to go with the telephone, but that would be too on the nose. So I'll go electricity.
And if you had the opportunity to join any innovation team in human history, which team would you join?
I would say the innovation team, the Wright brothers innovation team.
Wow. Yeah. So you're going way back.
Going way back. I would love to have been at the table with those 2 guys in North Carolina back in the day.
Knowing that you'd never get credit because the brothers stole all of that publicity for themselves.
Right.
Yeah. And then lastly, what is an innovation you wish existed that does not exist today? If you could snap your fingers and make it happen, it would.
I could go a lot of different ways with that one. I think the innovation that needs to happen, and again, because I'm so focused on healthcare, I look forward to a world where wherever I go in the US or anywhere on the planet, that if I have something go wrong, my doctor or nurse can pull up on their phone or tablet my complete health history and know who I am from a healthcare perspective in real time and can help me when I need it the most. I think we're not there yet, and we need to get there. And I think that would be a great innovation to try to get to.
Yeah. It's pretty incredible, right? Facebook probably knows more about us than our doctors, even from a health perspective.
Facebook has a lot of data.
Our Apple has a lot of data from our wearables and stuff. Yeah. Well, Robin, it has been a fantastic conversation. If people want to get in touch with you, what's the best way to do that?
You can find me on LinkedIn. I also have a podcast. It's called Healthcare on Air. So
that's right. Healthcare on Air. People, check it out. Yes. Go ahead. I'm sorry.
Yeah. That's a fun one. You can listen to those episodes where I get to talk to some really great folks who are really in the ditch doing the hard work of making healthcare better for all of us. And that's on Spotify and Apple. That's Healthcare on Air by Verizon. I'm on LinkedIn. Just Google my name. You'll find me. And I post to get them out and try to share what I'm seeing so that everyone can kind of understand our perspective as Verizon and see what cool new technologies I'm seeing out there and try to share that as much as I can.
Outstanding. Robin Goldsmith, thank you so much for joining me on the show today.
It was a pleasure, Susan. Thanks so much.